Hello, Diaz here, founder and owner of Greenwood Dental. Welcome back to my series, What's Up Doc? Storytelling. I hope you guys are doing well. And today's story is about my wisdom teeth and my molar that was mysteriously had a cyst and we couldn't diagnose it. It was literally probably took 5 different dentists to look at the x-ray and we couldn't figure out what happened. So let's start with the story. Okay, the story goes that one day, I think about 2010, 2011, I developed pain behind my left eye. Sharp pain, and it was crucial for me to actually practice because pain, as you know, is very distracting. I couldn't figure out what it was. I tried to clean my sinus. I tried to treat my, dry eyes. I tried to relax my eyes because of straining of wearing the loops and the magnification. I thought I was working too hard since I was putting about 11 to 12-hour days fixing teeth. I tried everything, but it won't go away. So we took x-rays. We couldn't see anything that would contribute to that kind of pain. It was random. I was going and coming. It wasn't constant. I felt like when I strained my eyes, it got worse. It's like that stabbing, it's like I had to stop and just take off my loop and stuff and try to rest it a little bit. We couldn't find anything on the x-ray. So I said, well, it could be, just sinus pressure. I see that all day. I talk to a patient all day, every day about it. So again, made sure that my sinuses are clear. I said, maybe it's seasonal, maybe it's stress, working too much, and so forth. And after a year and a half, about 18 months, I just had it. Now, granted, where the pain was, I have an implant, and I had a molar behind that implant that had an old root canal. So me being a dentist, of course, the first thing that I thought was like, oh, my root canal is failing. I have to do something about it. So what I did, I went back to the root canal specialist that did a root canal, and I showed him my x-ray, and I said, I can't live like this. Do I have a tumor? I literally believed like I had cancer, like a tumor behind my eye. I Googled it, of course, I researched it. I got obsessed by like knowing what would that mean for me. And so I went to him and I said, you got to do something about it. What if we take a look at the tooth that had a root canal? So he took an x-ray and he said, he tapped on it and he looked under a microscope. He said, the root canal looks fine. It's sealed. I don't see any shadows. Probably hear us say that all the time, shadows around the tooth that could cause any concern or question the failure of the root canal. So I said, all right, I was convinced I had a tumor. I had cancer and I have to live with it. And I said, you know what, if I don't complain, I don't explain, I'm not gonna go and dig and all that. And I said, how about like a 3D image, 3D image, a CT scan? He said, yeah, we can do a CT scan and take a look at it. So I went to an oral surgeon and they did a CT scan on the tooth. And they said, oh, it's fine, and I don't know where the pain is coming from. Again, confirm my theory, and I was convinced I had cancer or a tumor, behind that. So, anyways, as time went by, I called back the oral surgeon. And I said, well, I can't work like this. The pain is when it comes, it's really, real severe, and it's dangerous because I can't work in pain. If I drop the instrument and with that sharp pain behind my eye, that's not good. So he's like, okay, I went after hours and he opened the tooth, and the tooth that had a root canal in my upper left, it just gushing. It's like a volcano of blood draining. And he looked at it under a microscope, and he honestly was baffled. He didn't know where that blood is coming from. And, you know, he looked at the 3D imaging, trying to kind of locate or figure out the anatomy of the tooth. And he said, I'm glad I opened it, because there's that probably the pressure that you're feeling, and it's bleeding as we speak. So I'm going to leave it open. I'm going to let it drain. I remember I had a trip going to Quebec City, and I said, like, you know, I'm going away for a long weekend. He said, perfect. You get to relax and not worry about it and let it drain. And when you come back, I'll reevaluate it. So literally, I would taste blood constantly. Where is it coming from? I wasn't like vampire, like blood out of my mouth, but I would like, oh, it's bleeding again. Oh, it's bleeding again. And the funny thing about it was, it will bleed and it will stop. And then what triggered it? It was random. I couldn't figure out. And I am an OCD, very analytical, very like, you know, diagnostically oriented, and trying to figure it was driving me insane. So I went back to him after a week, and he looked at it. It was open. He said, okay, well, still bleeding. I have no idea. And I said, you know what? I just want the tooth out. Whether it's connected to the pain or not, I just take the tooth out. I'll put replace it with an implant. Don't redo the root canal. He offered to do the root canal for me. I was like, no, don't do the root canal. I'm good. I don't want to go through that again. And I said, I'm just going to take the tooth out. So I went back to the oral surgeon. So I showed my x-rays to my associate at the time, to my partner at the time, and they couldn't find anything. The root canal specialist opened it and let it drain. Couldn't find anything, has no idea where that pain is coming from. And then the oral surgeon who took the 3D imaging says, there's nothing wrong. I don't know why that would hurt you. I don't know why you would have that kind of pain. So as I went through the, you know, my checklist right there, the last thing is like, I have a tumor. So I was again convinced that I had cancer, but I put that aside. And I said that, you know what, I just want the tooth out. Let's clear that area, go through the process of elimination. If I took the tooth out and the pain is gone, it's the tooth for some reason, for some crazy reason, which I can't find. Neither for two specialists and two other general dentists can't find the reason why. But if we take the tooth out and I still have pain, I have a tumor somewhere. So I have to go like to an oncologist or whatever. So I called the oral surgeon and I said, listen, I've done my due diligence. I have consulted with a root canal specialist. You know, my partner, my associate, they don't see anything. I don't see anything, but I know what I feel. And I said, you know what? I just want a tooth out. They're like, why would you take the tooth out, redo root canal? I'm like, listen, I've been going through pain for about 18 months. I've been like tasting blood. Like, I can't work like this with a stabbing pain behind my eye. It's dangerous, you know, I can't do that. So they're like, are you sure? You know, I'm like, oh my God. And those are my friends. I mean, those are my colleagues. Like, and I was like, are you asking me, am I sure? Take the tooth out. The worst case scenario, you can put an implant in there, but I have to go through this process of elimination to find out whether I have a tumor or not. You know, that's my concern. Hell with the tooth. So they said, okay. So I went in there and, you know, I had all my records, the x-rays, the PAs that I took, and they're like, okay. So they numbed me up and, you know, they're talking to me as they're working because they're my friends. And he finally took the tooth out and I heard a pop. And he put the tooth on the tray and he's like, and all I heard is like, oh, look at that. And I was laying down. I got up. I was like, what, what'd you see? And he's like, you had a cyst on the back root of that tooth. I'm like, a cyst? So we looked at it, it looked like literally a little bubble gum bubble hanging like on the back root of that molar, which in my mind is like, oh, okay, now it's close to the sinus. So every time so what cysts do, they fill up when there's, you know, the right condition, the right circumstances. They fill up and they drain. They fill up and they drain. And that's what the stabbing pain I was having is like on, off. So when the root canal specialist, now it makes sense. When the root canal specialist opened it up, it actually popped that cyst and it was draining on and off, draining on and off. So I did not have a tumor. So that is, I did not have a tumor. I'm not crazy. There was a reason for the pain. Two specialists, two general dentists couldn't figure out why. So my intuition or my gut feeling tell me that just get rid of it and, you know, and then we'll figure it out whether the tooth is not. So the reason why I'm telling you this story, dentistry is not straightforward. So don't get frustrated with us when we say, we have no idea why you're in pain. It's not like we are in disbelief that you're in pain, but if we don't see it, look at my experience. If we don't see it, if we can't diagnose it, we can't treat it. If we can't treat it, we don't know what's going on. So if I had to go through hell with 18 months with all the expertise that's under my feet, they couldn't know what it is until we actually start to. I'm not saying that with every pain take a tooth out, but you have to go through the steps. The impatience of the process sometimes gets frustrating for you guys. So that's the reason why we have to go through the process of elimination and the process of diagnosing something and give it a benefit of the doubt until we actually have a reason to do an invasive procedure. Now, in my case, I pushed for invasive procedure because I said, you know what, I give a consensus, like take a tooth out, I can put an implant later. Now, would I put an implant back there? No, because I don't miss it. And the way I bite, my implant, I have one more molar, that was the second molar. So I have an implant and then a premolar and then on my molar, and my bite is fine. I don't miss it. My jaw did not suffer from, you know, like imbalances and all that stuff. So I hope that helps. And I hope that brings a little bit of, you know, an insight to what we have to go through. Like I said, the thought process. And I hope you guys enjoy it. So we love you. Be safe. Until the next confession, DS out.